Ever get that feeling, like the little piece of the electronic health record you're working on is like the only piece that matters? Like your coding standards, your user interviews, the API you're building, that's the whole story.
Oh yeah, I totally get that. When you're so focused on the details, it's easy to lose sight of the bigger picture.
Reminds me of this TED Talk, Chimamanda Ngozi Adichie, talking about the danger of single stories. She was saying, how if we only hear one narrative about someone or some place, it totally limits our understanding. And I was thinking, we do that with EHRs too, don't we? We create these single stories.
Absolutely. Think about it. Someone who's like amazing at clinical documentation. They know exactly how to enter data to meet all those regulations. But do they really get how hard it is to pull that data out later for analysis?
Right.
Or take a brilliant developer, they can build incredible new features, but maybe they don't fully grasp the legal and ethical stuff around who can access that data. All those rules.
Mm, exactly. We get so good at our own little piece, which is important, don't get me wrong, but then what happens when you have to work with a different part of the EHR world? Like, you built this amazing feature, got great feedback from one clinical team, works perfectly for them.
But then, boom, someone wants to integrate that feature, or the data it generates, with another department, maybe even an external system. And all of a sudden, everything you assumed during development, data formats, workflows, security, it might not work anymore.
It's like you've been playing this solo, beautiful music, right? And then someone says, hey, join the orchestra. And you're like, wait, I need to know how to harmonize. That's kind of what we're diving into today. The power of seeing the EHR not as separate pieces, but as this like interconnected network.
Yeah, because health information, it's not static. It doesn't just stay in one module or one organization. It flows between different parts of the EHR, across departments, even between different providers. And now, with these health information exchanges, it's going even further. So if you only understand your little piece of that flow, you're missing so much context.
Okay, so let's get specific. Imagine you've nailed it. You integrated lab results into the EHR. Clinicians see the reports, data is stored correctly, you're a hero.
But then, uh-oh, public health crisis.
Where?
The health authority needs data on specific lab results, like yesterday. And now it's not about just displaying the data internally. It's about sharing it securely and quickly with someone outside the system.
Whole new ball game.
Right. You need standardized data formats, secure transmission, patient privacy, maybe even interoperability standards. Suddenly you're talking about structured data exchange, consent management.
It's like a whole new language.
Right.
And if you've only ever focused on the internal workings of the lab module, this external demand can feel impossible. By the way, if this is ringing a bell, we've got some great resources in the comments and description to help you out with interoperability and all that, links to frameworks, standards, all that good stuff.
Because the bottom line is, an EHR isn't just a bunch of features. It's this complex ecosystem. Every single element, from the data entry screens to the reporting tools, the security to the interfaces, it all plays a part in the patient's healthcare journey.
So understanding the full story of the EHR, it's not just some abstract idea. It really affects how effective we are as health tech professionals.
Definitely. When you understand how everything connects, how the different parts of the EHR and the whole health information world interact, you get some major advantages, like communication.
Oh, yeah, huge.
You can talk to clinicians about their data needs, developers about what's technically possible, privacy officers about compliance, administrators about strategy. You actually get where they're coming from.
And that makes you way more confident. You're not just doing your task in a vacuum, you're part of the bigger conversation. You see how your work helps improve patient safety, keeps care continuous, supports those big health initiatives.
You start thinking more strategically. You see problems before they happen. You build more interoperable solutions from the get-go. That's the kind of expertise that's in high demand right now. People who can bridge the gaps and really drive innovation.
It's not just about managing your piece of the puzzle. It's about understanding how all the pieces fit together. And yeah, in-depth knowledge is great, but the real skill is connecting those different areas. The clinical, the technical, the legal, the strategic, it all overlaps.
So what can you do, right? How do you expand your understanding beyond your current focus? Start with curiosity.
Love that.
Learn about how your work connects to other parts of the system. Ask where your data comes from, where it goes, what security measures are in place, what consent models are being used. Get familiar with those data exchange standards.
Think about a piece of data you work with all the time. Follow its journey, who creates it, who uses it, what other systems or processes rely on it. Understanding that data lifecycle gives you so much context.
It's like Adichie was saying, it's not that your understanding is wrong, it's probably just incomplete. You need to see beyond your single story.
So here's the question. Are you ready to move beyond just getting through your daily tasks and actually shape the future of healthcare by understanding the whole interconnected story of health information?